Journavx, generically known as Suzetrigine, is an innovative non-opioid analgesic approved for the treatment of moderate to severe acute pain in adults. Developed by Vertex Pharmaceuticals, it represents a major advancement in pain management by providing effective relief without the risks associated with opioid use. Pain is a complex physiological and psychological phenomenon that significantly impacts daily life. Traditionally, opioids have been the primary treatment for moderate to severe pain, but their use is associated with serious risks such as addiction, dependence, and overdose. Opioids are drugs that bind to opioid receptors in the central nervous system to block pain signals and produce euphoria. While effective for pain relief, they have a high potential for abuse. These are most common opioids. Morphine, used for severe pain, including post-surgical and cancer-related pain. Oxycodone, known by brand names like OxyContin and Percocet, is commonly prescribed for moderate to severe pain, but has a high misuse potential. Hydrocodone, found in medications like Vicodin and Norco, is frequently prescribed for injuries or post-surgical pain. Fentanyl is a synthetic opioid much stronger than morphine, often used for severe pain in cancer patients. Codeine is a mild opioid used for moderate pain, often combined with other medications. Given the opioid crisis, there is a need for safer pain management options. Journavx, also known as Suzetrigine, provides pain relief by targeting peripheral pain pathways rather than central opioid receptors. This approach minimizes the risk of addiction and other opioid-related side effects. Suzetrigine selectively inhibits NaV1, 8 sodium channels in the peripheral nervous system. These channels play a key role in transmitting pain signals to the central nervous system. By blocking them, Suzetrigine prevents pain perception without affecting brain function, thus reducing the risk of sedation and dependence. Journavax's efficacy and safety were established through multiple clinical trials, including randomized, double-blind, placebo, and active controlled studies. Trials demonstrated significant pain reduction in patients undergoing procedures like abdominoplasty and bunionectomy. Based on these findings, the United States Food and Drug Administration approved Journavx in January 2025. Journavx is indicated for the short-term treatment of moderate to severe acute pain in adults. It is not intended for chronic pain, and its safety in pediatric patients has not been established. Initial dose 100 mg orally on an empty stomach 1 hour before or 2 hours after food. Subsequent doses 50 mg every 12 hours for the next 2 doses. Maintenance dose 50 mg every 24 hours, starting 12 hours after the 4th dose. Patients should avoid grapefruit products as they can interact with the drug. Journavx is contraindicated in patients taking strong CYP3A inhibitors, as these medications can increase suzetrigine levels, leading to potential toxicity. Patients should consult their healthcare provider regarding drug interactions. Patients with liver disease may have an increased risk of adverse effects. Grapefruit products should be avoided as they can affect metabolism. Patients should monitor for signs of hypersensitivity. Common side effects include itching, muscle spasms, elevated creatine kinase levels, and rash. Mild side effects may include nausea, constipation, headache, and dizziness. Patients should report any unusual symptoms to their healthcare provider. Journavx may interact with CYP3A inhibitors, increasing drug concentration and potential toxicity. Patients should provide a full list of their medications to healthcare providers. Pregnancy and lactation. The effects are unknown, so it should only be used if the benefits outweigh the risks. Pediatric use. Safety and efficacy have not been established in children. Geriatric use. Limited data are available and caution is advised in elderly patients. There is no specific antidote for suzetrigine overdose, Supportive care and symptomatic treatment should be provided in case of overdose. Preclinical studies indicate that Suzetrigine does not have carcinogenic or mutagenic potential. Long-term studies are ongoing to fully assess its safety. Suzetrigine is a potent NaV1, 8-sodium channel inhibitor that blocks pain signals in the peripheral nervous system without affecting the central nervous system. This mechanism minimizes the risk of addiction and sedation. Absorption: rapidly absorbed, reaching peak plasma levels in 1 to 2 hours. Distribution: moderate plasma protein binding, ensuring effective distribution to pain receptors. Metabolism: primarily metabolized by CYP3A, with its active metabolite M6-SUZ being less potent. Elimination: 49.9% excreted in feces, with 9.1% as unchanged drug. Post-surgical pain. Clinical trials show significant pain reduction comparable to opioid analgesics. Lumbosacral radiculopathy, or LSR. A phase 2 study showed mixed results, requiring further research. Suzetrigine provides pain relief comparable to opioids, but with significant safety advantages. There is no risk of addiction or opioid-induced respiratory depression. Additionally, there is no central nervous system sedation or euphoria. The Institute for Clinical and Economic Review, or ICER, concluded that Suzetrigine is a cost-effective alternative to opioids and NSAIDs, potentially reducing opioid-related healthcare costs. Chronic pain management. Further studies are needed to assess its effectiveness in conditions like neuropathic pain and lower back pain. Long-term safety. Ongoing post-marketing surveillance aims to ensure sustained safety and efficacy. Journavx, also known as Suzetrigine, is a significant advancement in pain management, offering effective acute pain relief without the risks associated with opioids. Its approval provides a safer alternative for patients and healthcare providers, helping to combat the opioid crisis. Continued research will further define its role in pain management. Adherence is crucial. Patients must follow the prescribed dosing regimen strictly. Side effects should be reported immediately if any unusual symptoms occur. It's also important to disclose a full medication history to prevent drug interactions. When considering patient selection, individual factors such as liver function and concurrent medications should be taken into account. Monitoring for adverse reactions and interactions with CYP3A inhibitors is essential. Journavx offers a promising non-opioid alternative for acute pain, ensuring effective relief with a favorable safety profile compared to traditional opioids. Subscribe to Drug Insight Hub for expert analysis on top-selling drugs, pharmaceutical trends, and clinical breakthroughs. Stay informed, join our community today.